our instruction course, I will first call upon Dr. Jyoti Shakrawal, and she is currently working as an assistant professor in AIMS Jodhpur, and she has been a very dynamic senior resident with us, and still I'm sure that still she is performing very good well in AIMS Jodhpur. Jyoti, over to you.
Thank you, ma'am. Thank you for the kind introduction. So, good morning, all. So, we are starting our instruction course with the introduction and consent in razor
Jyoti,
procedures.
put the mics.
Okay.
Mm,
Should I on both the mics?
uh.
Okay. Okay. Now, sides, please. Okay. Thank you. So, as you all know, glaucoma management is aimed at reducing the intraocular pressure, which is the only modifiable risk factor we have. For that, we have medical therapy, laser therapy, and surgical procedures. So, the focus for now for this instruction course would be the laser procedures. A laser is an optical source that emits photon in a coherent beam. So, it differs from the ordinary light as it is monochromatic, directional, and coherent. The type of lasers which we are using in glaucoma are iridotomy procedure for angle closure glaucoma, trabeculoplasty procedures for open angle glaucoma, laser cyclophotocoagulation, which could be transscleral or endoscopic for refractory glaucomas, and lasers for post-op management of glaucoma, which is suture lysis or for the blood management. These all lasers we are going to discuss in our instruction course. So before doing any laser procedure, we need a written informed consent for a better patient satisfaction and for ethical standards. So, who is responsible for that informed consent? The clinician has the core responsibility, but of course, it is a team approach, and the contributions from the entire clinical staff is required, which include the clinician, the nurses, and the technician. Consent could be either implied or expressed. The behavior of the person indicates that he is willing for examination, and the treatment that is known as implied consent. The consent when a person voluntarily comes to your OPD or a clinic and consents to you for the procedure, that is implied consent. Express consent could be verbal, gesture, or written. When a consent is not implied, the doctor has to get the consent from a competent patient after explaining what he is going to do and the implication of what is to be done. Patient must express his willingness for the examination, investigation, or the treatment. It is must to be obtained in the presence of a third party. So the consent is not about the form, not about just signature or not just a piece of paper. It is much more than that. It is the process of communication between the patient and the physician that result in the patient authorization for agreement to undergo any specific intervention. So, while taking any consent, you have to explain the benefits of the procedure, the risk of the procedure, and what alternative procedure we have, and of course, the risk and benefit of that alternative procedure. Setting up a good environment is also equally important. Provide privacy to the patient, introduce self, determine who else should be present while taking the consent, ensure no interruption during the consent procedures, provide comfortable space to the patient, and create good environment. Turn off all the devices. Adults more than 18 years can sign the consent. For minors, parents must legally consent for their children for less than 18 years, and important to have assent form. So for example, we are discussing some important things which we have to tell the patient while doing any procedure. For laser iridotomy, tell the side effects of the pilocarpine to the patient, explain the patient that multiple sessions are required for this, and explain that it is not a surgery, it is just a laser. You may need any medical therapy or surgical procedures after this iridotomy. These are the consent form which we have in our AIOS guidelines for laser iridotomy, and also explain the potential side effects, risks associated with the procedure to the patient. For laser trabeculoplasty, explain the duration of the procedure, that it can take more time, not just 2-minute procedure, it can take 10 to 20 minutes. Few weeks will required for the laser effect to come, and most of the patient require medical or surgical therapy after the procedure. This is the consent form we have same under the AIOS guideline for the trabeculoplasty procedure, and the potential Side effects of the procedure should be explained to the patient. For any psychodestructive procedure also, you have to inform the patient that it is a OT based procedure which would be done under a block, and explain the nil visual prognosis to the patient, and the need for multiple procedure should be explained. Anti-glaucoma medication might required after the procedure. Of course, all the side effects associated with the procedure should be explained to the patient. So this is a video. Our resident is explaining the procedure to the patient. Voice, please.
प्रक्रिया है जो कि उन पेशेंट्स में किया जाता है जो कि एडवांस काला मोतिया के होते हैं, जिन पे दवाइयों का असर या फिर बार-बार काला मोतिया के ऑपरेशन का असर नहीं हो पाता है। लेजर से आंखों में दर्द कम होना और आंखों का प्रेशर कम किया जाता है। लेजर जब करते हैं तो इसके लिए आंखों को शून्य किया जाएगा, जिसमें एक इंजेक्शन आंखों के ऊपर लगाया जाएगा, दूसरा नीचे लगाया जाता है। हालांकि इससे कुछ दुष्प्रभाव भी हैं, जैसे कि आंखों में लाली आना, आंखों में सूजन हो सकता है, जिसके लिए हम आपको खाने की दवाइयां देंगे और आंखों में डालने की दवाइयां प्रदान की जाती हैं। कुछ समानता कुछ इसके दुष्प्रभाव भी हैं, जैसे आंखों में दर्द होना, लाल होना, सूजन आना, पुनः ऑपरेशन की आवश्यकता पड़ना और कुछ।
After explaining everything to the patient, allow the patient to put questions. They can ask anything if they are not understanding. Can you please start this video?
मतलब इसके बाद दर्द वगैरह तो ज्यादा नहीं होगा?
दर्द के लिए आपको दवाइयां दी जाएंगी जो कि खाने के लिए भी होंगी और आंखों में डालने के लिए होंगी, और प्रक्रिया के बाद अगले दिन और एक हफ्ते बाद आपको ओपीडी में आके फिर से दिखाना पड़ेगा।
So give time to the patient and allow him to put or ask any questions associated with the procedure. So consent that is not fully informed is not an informed consent. Consent is not a piece of paper. A signature on form is informed consent. The purpose of informed consent is to protect both the patient and the doctor. So to improve our consent procedures, simplify our language. It should be in patient's own language. Allow time for questioning. Make sure the patient understand. Consent should be in simple language. And plan for language assistance in case the patient is not knowing your language. And train the supportive staff while taking the consent. Thank you.
Thank you, Jyoti, for covering this important, yet so important topic in a very precise manner and going through all the important tips. One thing I would like to highlight, especially for cyclodestructive procedures, the most important thing is to tell the patient that it is a painful procedure. Many patients see their relatives or other patients going laser iridotomy and they think it is painless. So you tell them this is a painful procedure, otherwise they come back to you or they'll cause a lot of ruckus saying that it is so painful, you didn't tell us, doctor. So that is one thing is there. Dr. Faisal, you would like to say something?
I think taking an informed consent is very essential. Often in a busy clinic, sometimes even residents are going to do the procedure. Most often the explanation was not proper. So I think the consent is the most important nowadays. Even it is simple, very simple procedure. We are sure to take a consent.